pandemic still ongoing and the vaccine nowhere near completion, the demand for healthcare providers, especially for nurses, are still at an all-time high. But what is a nurse? What's so important about them? And what are the roles that make them so important? Today's report is going to be about the nurse, the role in providing safe, competent, and ethical care. To start things off, we are going to be joined by a very special guest, Deputy Director of the Nursing Institute for Canadian Excellence, Miss Esther Yobu. Thank you for joining us, Esther. So, as an expert on the field of nursing, what's so important about nurses? What's so unique about them with the roles in society?
Thank you for having me on the show today, Mr. Dainab. Nurses are considered the frontline workers in healthcare. There are several roles we as nurses play in the community, but I'll mention only a few. Nurses collaborate to restore health and wellness of the patients and clients under their care. They administer treatments and medications. They advocate for health and wellness. They monitor patients' health and they record signs. They also educate the patients on how to manage their illness. In the process of exhibiting these roles, there are standards to be met. The scope of practice. This is the legislation that sets the legal limits of what an LPN can do. The standard of care, this is the minimum care to be given. And then the code of ethics. The code of ethics serves as a guide for decision making and behavior.
So tell me, Esther, why is it important to receive safe, competent, and ethical care?
This is important because it protects the public. Nurses have an obligation to provide safe, competent, and ethical care to their clients in accordance with the standard of care and relevant legislations. Competency in nursing is integrated knowledge, skills, judgment, and attributes required of the nurse to participate safely and ethically in a designated role and settings.
Thank you, Esther, for enlightening us about the importance of safe, competent, and ethical care. Now today I'm joined with my fellow news anchor James that will be discussing more about the details about competent care. James?
Thanks, Dainab. Competency in healthcare might sound complicated, but actually it's very simple. It is, in effect, the ability of healthcare providers, regardless of title or role, to make sound and rational decisions regarding healthcare and demonstrating and understanding the ability to see the consequences of that care. Now, let's go over to our field reporter, Hanson B. Wonderful, for a live look-in on competent care. Hanson?
Thanks, James. I'm here at Sacred Hearts Hospital, where we're going to see some actual healthcare practitioners in action.
Hello, Mr. Johnson. I got your supper here for you. Oh, you don't look so great. Let me just have a quick assessment on you. Okay, everything looks fine. However, how about we just let's have something to eat first so that you'll be full before we do the next assessment. Okay. Let me quickly check the temperature too. Everything's fine. Again, we'll just have to do a next assessment, so that we'll be sure that you are all good. But we have to you have to eat something first. Okay? Okay, let me help you up now. Right, take it easy. There you go. Was that too hot or was it too cold? Right. There you are.
Well, what about that? If that's what it's like here at Sacred Hearts Hospital, then sign me up. Let's see what other versions of competent care we can find.
Hey, Mr. Smith, how you doing? Oh, you look fine. Well, hello? Well, you look kind of lethargic, but you look fine to me. It's my lunchtime, and I think it's yours too. Eh? Come on, let's go get something to eat. You hungry? Because I know I am. Woo! These popcorn is good. Here, you have some. Oh, it's starting again, Mr. Smith. Open wide. Boom!
Well, I'm not quite sure what to say about that. Back to you, James.
Thanks, Handsome. They're kind of all over the place there at Sacred Hearts Hospital, it seems. Very interesting to see what it looks like to see competent care in action, and also when it's not, and it's incompetent. But then again, you are the one talking into your hand. Back to you, Deneb.
Thank you, James, for that. Beside me is my other co-anchor, Alan, who's going to discuss more about the safety in care. Take it away, Alan.
Thank you, Deneb. Hello, and hello to all fellow students who are watching and listening out there. Ensuring safety. Safety is fundamental to nursing and healthcare across all settings. It is not merely a mandate, it is moral and ethical and imperative in caring for others. It is defined as reduction and mitigation of unsafe with healthcare system and in the use of best practice shown to lead to the optimal patient outcomes. Patient safety is a critical aspect of quality healthcare. Let's see some examples in the field that define what safety is all about. Hello, citizens. Today, I'll be playing a video sent by one concerned citizen who wished not to be identified. His experience has led him to expose such practices. For him, it has to stop.
Hey, how are ya? How you doing, Mr. Johnson? I'm actually going to be drawing out a little blood sample from y'all. Yeah, I just need it for the screening. It won't hurt a bit. All right, it's not going to be that bad. It's going to be just a little prick. And boom. There you go. You don't feel no pain, right? My mama used to say it's just a little bit of an ant bite. All right, well, thank y'all. I'll come see you later, okay? Oh, I forgot to put my gloves on. Whoopsie. That's okay. Nobody's got to know. You're not going to tell on me, are you, Mr. Smith? All right. Well, I'm off to Mr. Johnson. I got to get his stuff, too. All right. See ya. Bye.
All right, for now, the initial steps on donning the full equipment is washing your hands. Washing thoroughly. Okay, now we're showing you the proper donning of the mask, which is making sure that the blue side is out and making sure that the mask is fully sealing the face, covering the nose and all the way down to the chin. Okay, and now we're showing you the proper way of donning the equipment. There are lots of easy ways to do it, but this one we find it easy. Tying the line on the head first and move it over your head. And making sure that at the back,
Where is it?
it's on the side.
Oh.
There you go. There you go. And goes in at the back to make sure that it doesn't come off. And next would be the gloves. This is important here because the gloves needs to go over the gown and making sure that there's no skin exposed. There you go, making sure that everything is sealed. Well, that's one quite scary scene to see. A question for you all. Is that seems normal? Did the healthcare provider act professionally? Would you feel safe? Well, we'll let you decide on that. For what we know, it's not right at all. It's all unethical and substandard practices. Back to you, Ned.
Thank you, Alan. Finally, I am going to report on the last component, which is ethics in care. So what is ethics? Ethics is knowing morally right from wrong. So ethic in nursing is basically applying that same concept, but in a professional sense. It is a guideline in which healthcare providers, or nurses in particular, respect, be responsible, and be accountable for the rights of the client. As mentioned by our specialist Esther earlier, this is where the standards of practice, the scope of practice, and the code of ethics come into place. It provides a framework for healthcare practitioners or nurses to follow in order to protect the public and their clients. It is also important to know that the delivery of ethical care, it allows the patient to achieve a better outcome, therefore leading to a better state of mind and being healthy and a better well-being. Let's go back to the situation of the hospital and let's see some examples about ethical care. Here we can see those same employees with regard to their respective patients X and Y. Let's see how they handle the details of each patient's information.
Hey James, how's your day?
Oh, pretty good, Alan. Thanks for coming in a bit early.
Sure do.
Mr. Johnson is stable. He just had his morphine. He's getting it PRN. I've informed him about that. He's consented. I've also informed the family so they know what's going on.
All right, great.
Hey, baby girl. What's happening, girl? What you doing? Yeah, no, I'm just calling you because I got this patient of ours, right? You remember that old guy used to be your neighbor? Yeah, that's the one that called me a little prick. Well, I looked into his gown and checked his junk, man. Who's the little prick now? Yeah, you wouldn't believe, like, I checked his medical history. Did you know that he's an addict? Yeah, all of those crazy stuff he's putting in the system, man. It's just crazy how much of an addict he is. Yeah? Oh, yeah, he's getting morphine right now. I bet you he's just trying to get his watermelon sugar high. We have another scenario here where both nurses need to assist a patient in need. Let's see how they handled it.
Oh, hey there, Mr. Johnson. You need to use the toilet? Well, I'm going to be right in there right now to help you with that, and we'll get you taken care of, okay?
Hey there. Oh, you want to go use the toilet? No, you can go pee in your pad for now. Because I'm actually going to be heading my break right now. So you go pee in your pad, and I'll be back. I'll change you later. Get you one of those fresh ones, eh? All right, bye. Wow. These reports is such a big eye-opener. Now I'd like to ask our specialists in our team about their thoughts. Let's start with Esther. Your thoughts?
In the first scene, the good nurse showed competency in care and was very professional in carrying out his duties towards the patient. He deserves an award for his behavior. He That was a very good nursing practice. On the other hand, the bad nurse was negligent and incompetent. His actions could cost him his job, or rather should cost him his job. Disciplinary actions should be taken against him. The second sin is about confidentiality and privacy. Are there exceptions to the duty to maintain confidentiality? Yes. The most common exception is the disclosure of relevant health information, both verbal and written, within the healthcare team in order to assist the patient with his health. And this is exactly what the good nurse exhibited. For the lousy nurse, there are consequences to his actions. A patient may take legal action in the event of improper release of health information. Also, a nurse can be sued for negligence, breach of confidentiality or privacy, or defamation. A professional licensed body may institute disciplinary proceedings alleging that the nurse has breached the duty of confidentiality.
Well, you're not wrong there, Esther. Care isn't really care if it isn't being delivered in a competent manner, done safely, and done ethically. Pretty scary to see the consequences of the opposite happening. At times like this, I'm just glad I'm just an anchor man. Now, where's my on-air Danish and my cash bribe?
Maybe later on that, James. I agree on what you said there. The world won't be the same if we don't have competent, ethical, and safe healthcare providers. That's all.
I agree with what everybody said regarding the topic. It is important for the role of the nurse to make sure that they provide safe, competent, and ethical care, because if you take one of those components out of the system itself, it'll ruin the whole nursing process. As a special treat to our viewers, let's go look at the outcomes for both patient X and Y. Here they are now. Here we have a video of patient X. He looks fine, he looks happy, he looks content. It looks like whatever the good nurses did worked well with him. And now we have a thing of patient Y. And oh my God! What happened to patient Y over here? He looks poor. His eyes are bulging out. His teeth are all rotten. Oh, my. Now, I think I know which nurse did this man's care, that's for sure.
In a world where healthcare providers are needed more than ever, these two real-life superheroes are on the front lines delivering competent, safe, and ethical care. But why do they do what they do? Is it for the money? For glory? No. They, our men and women, stand shoulder to shoulder with them every day for one simple, irrefutable reason. They care, goddammit. They just care. Also, in that same world, there's this guy. We're not sure why he's a healthcare provider, since he's never provided any care at all. He's incompetent, careless, and doesn't give a thought to his patients' privacy or dignity. In fact, I'm so disgusted by him that I'm not going to use this cruel voiceover voice anymore. Get out of here, you bum. No one likes you, and you smell like pea soup. You're a disgrace to all the hard-working, dedicated healthcare professionals out there. Look, I said beat it, and we're not going to validate your parking either.
Well, what a wonderful report this has been. I would like to thank our expert, Esther, for taking some time to join us, and to my fellow choral anchors, James and Alan, for assisting us today in our report. In behalf of the Associated Independent News team, we thank you. Be safe, be kind, and rewind. Have a good day.